Well, chances are you or someone you know snores. And according to the Snoring Center, nearly half of all Americans are affected by disruptive snoring at some point in their lives. If this is you, listen up. A scary new study says that snoring actually increases the risk of heart attack more than smoking. Joining us now with what you need to know is Dr. David Samadi with the Medical A Team. Thank you for joining us this morning.
Good morning. Thank you.
So snoring, it's not just disruptive, it's not just annoying, it can have some significant health effects.
Heather, this is actually a very, very important study because for many years we've talked about sleep apnea and how having a serious snoring would be hazardous to your health. Now a study that's coming out of Detroit looking at about 1,000 patients in the sleep center, they're finding out that snoring is as dangerous as high cholesterol, smoking, diabetes as a risk factor for heart disease. And the way they're doing this is very, very interesting. They think that the vibration and the trauma of the snoring can affect the main artery that brings the blood flow from your heart to your brain, and it increases the risk of stroke and heart disease. This is the first time we're getting this kind of news. So what I want people to know is that if someone next to you is actually snoring, instead of just elbowing them and thinking of it as a nuisance, now you have to take it seriously, and you need to bring that person and treat it well with the ENT surgeons and the sleep centers and find out exactly what the risk is.
But it's not just the patients who need to change their outlook on snoring and how significant it is. It's also the health insurance companies because they treat this as a cosmetic issue.
Right. Until now, we were not able to really prove exactly what the dynamics of snoring is. And they're finding out that the arteries are actually getting thicker and thicker, and that's the foundation of having high cholesterol, atherosclerosis, and the risk of heart disease. So now the insurance company have to take it seriously as a real health hazard. They're saying it as bad as smoking. Can you imagine 50% of America is actually snoring, and this is one secret risk that we never paid attention to as opposed to other risks. So, it's a very serious study. I think we need longer follow-up and bigger population to go into this, but don't ignore this. If someone in your household is snoring, this is a real health hazard when it comes to heart disease.
So your advice is, bottom line, go to the doctor, get checked out.
That's right. There are a lot of sleep centers around you that you need to check in and find out exactly what the physiology is. They give you a whole report of what the dynamic is. You take that to your doctor and you treat it seriously.
Okay.
You can prevent weight gain, you can prevent obesity, and most importantly, as we mentioned, heart disease.
All right. Thank you so much, Dr. Samadi. We appreciate you joining us this morning.
Thank
Good
you
to see
very much.
you too.